Now let's go through the numbers. These are statistics for PAD patients who are diabetic. So tell us more about these and how serious having diabetes and PAD can be to an individual. Starting with 15% of diabetic experience foot ulcers.
This is one of the things that is not really known very well by particularly primary care physicians in general. It's not taught. When I did my training in internal medicine, I was fortunate enough to have this sort of training because we had vascular medicine as part of the training. So we forget that patients with diabetes, as again, a second piece that my professor used to say, their care should start from the foot on up, because this is what they're using most of the time, most pressure taking trauma. So 15% of all diabetic patients at some point in their lifetime will have some sort of an ulceration or a foot sore.
Now, Dr. Kim, I want to ask you a question as well, because it says 40 to 50% of non-traumatic amputations are diabetic patients. Explain, elaborate a little bit on that.
Well, diabetics, again, they suffer from peripheral arterial disease, but also peripheral neuropathy, which means that they lose the sensation in their feet. And 60 to 70% of diabetics end up with peripheral neuropathy. So the combination of poor blood flow and the inability to feel their feet results in perfect storm for infections to develop, wounds to develop. And once they develop, then with the high glucose and the inability to mount an effective immune response, they end up with big problems very quickly, whereas a normal non-diabetic patient with good blood flow would heal the wound in no time. It would be no problem. So again, very important for diabetics to follow up routinely with podiatrists if they notice anything that looks abnormal at all.